We are Group 4 presenting on school nutrition. Group members are Casey Cohen, Jordan Thornton, Melissa Rodriguez, Lauren Guy, Lizet Lomeli, Audrey Jones, and Brenda Cabrera.
Description. The causes for poor nutrition in schools are obesity prevalence among children, unhealthy food options in school settings, food preparation habits likely to extend into adulthood, families in need often ineligible based on current criteria, burden of food insecurity, food benefits and programs have begun to decrease in quality and efficiency.
The evidence of the current issues with the school nutrition in Monterey County is shown through the 2020 NSLP report. In 2020, the NSLP spent approximately $14.1 billion on school lunches, which averaged about $1.30 per student, of which included food costs, labor, electricity, and cafeteria equipment. 64% of the NSLP budget went towards meat, dairy, and egg products from factory farms versus locally sourced food, of which we see as a disservice to the local farmers and agricultural companies local to Monterey County. 34% of county residents and 66% of farm workers were food insecure, and approximately 108 public schools in Monterey County went without the school breakfast program, and only 41,694 were eligible for free or reduced price school meals.
I'm Lauren, and I'll be talking about the causes of the problem. There are a multitude of factors that have contributed to unhealthy eating habits amongst school children, such as a lack of access to healthy foods due to cost and a lack of time in current school curriculum to teach children about nutrition, as well as external factors such as children that live in poverty or low-income households, lack of affordable housing, summer break, and even the COVID-19 virus plays a role in this problem. Children are more likely to face food insecurity since they are unable to provide for themselves. Children are also surrounded by unhealthy options such as vending machines that are often in hallways and cafeterias at school. In addition, school lunches are made with poor ingredients due to keeping costs low. With schools having a limited budget, this limits the quality of ingredients that can be used to feed kids. Another factor is the lack of education that children receive in schools with current curriculum standards. There is a lack of time to teach children about nutrition. According to the Centers for Disease Control and Prevention, U.S. students receive less than 8 hours of required nutrition information each year. Another element that contributes to students' unhealthy eating habits are children that live in low-income households or have lack of access to affordable housing. Monterey County is the childhood poverty capital of California with a 30.3% child poverty rate. With children coming from low-income households, they may not have money for school lunch or the ability to bring a healthy lunch from home. A more recent issue was the COVID-19 and school closures. Even prior to COVID-19, children and students in Monterey County rely heavily on school meals as their only source of nutrition. Some families depend on school-provided lunches to feed their children, but shutdowns impacted some kids' access to food. This also happens to students when school is closed for summer break. According to Monterey County, back in 2014, 52,011 Monterey County children received school meals throughout the school year, but only 6,741 students received meals during the summer break. This means that 45,270 children could have gone hungry during the 3-month summer break. Initially, when the issue of school nutrition became a policy, the target was to fight against children being underfed. However, the issue today is trying to battle against children going hungry as well as obesity. Although feeding programs date back to the 1700s, the government did not get involved until the Great Depression. During the 1930s, there was a surplus of food produced by farms. In 1935, Public Law 320 was passed by Congress, which allowed the government to purchase food from market and distribute it where it was needed. With an excess of food, schools became a popular choice as a place to channel that food. However, during the time of World War II, there was a shift in where resources such as food went. During this time, food was shipped overseas and lessened the amount of food that was being distributed to schools. Even though there was a lack of resources available due to war, Congress had recognized that there was an issue and implemented the National School Lunch Act in 1946. Subsequently, over time, more programs were implemented to help target issues of malnutrition and food insecurity. The most recent program that was implemented was in the 2022-2023 school year. California became the first state to enact a universal meals program for school children. With this program, all children are entitled to a nutritious breakfast and lunch every school day. Even though now the state of California has made provisions for each and every child to obtain a meal, there are still issues with the quality and nutritional value of the school meals since they are required to follow federal nutritional guidelines which have room for improvement.
When looking at who the stakeholders are in regards to school nutrition, we found students and families of students to be the most affected. Student health and wellness is directly affected through the nutrition provided within schools and are also directly impacted by any and all school policies implemented. Students and their families are expected to adhere to any policy changes within the school nutrition plans and also are expected to pay for any school meal programs. The secondary stakeholders are school leaders and local, state, and federal government institutions and their representatives. These parties are responsible for changing and implementing school and health policies, for collecting and distributing funds, and also ensuring adherence to policy changes. They hold a direct connection to student health issues based on their power over nutrition policies made. We also consider health insurance companies to be a secondary stakeholder based on the fact that they would cover a majority of the financial cost for any student healthcare needs.
In an effort to understand the public policy designed around school nutrition, we have looked into the National School Lunch Program as well as the Universal Meals Program. Under the National School Lunch Program, there is now a federal standard of nutrition for all school lunches served to school children in the U.S. by providing subsidies for schools to be able to serve every meal according to this standard, as well as providing a program where meals can be fixed at a reduced or free cost to children in eligible low-income families. The NSLP set the stage for all other state, local, or federal programs designed around school nutrition. The second status quo policy is the Universal Meals Program, which builds on the NSLP by providing all school children with a free breakfast and lunch during the school day in California, regardless of their family's income. This program will redefine the importance of nutritional meals for children while they are at school, as well as reducing the social stigma associated with food insecurity in children.
Policy Alternatives Part 2. Alternative number 1, incremental policy change. The No Meal Plan Left Behind policy. It sets universal school meal purchasing costs for all schools in the 48 contiguous states rather than by the current policy of paying for food by the volume and cost within each state. It allows policymakers to develop and target assistance to food service programs facing more significant challenges. It allows more schools to offer healthy, nutritious meals to all students at a universal cost. Alternative number 2, revolutionary policy change, the farm-to-table policy. It changes how students and communities view food and nutrition while building skills and self-sufficiency and building healthy eating habits. It teaches children how to process food from farm to table. Process would include teaching gardening skills in terms of planting and tending to a garden, processing fruits and vegetables, and learning how to pickle and can foods to promote a no-waste lifestyle. It also provides opportunities to take field trips to and participate in local fresh produce markets and flea markets to promote community involvement and collaboration.
Policy Goals, Equity, Part 1. Definition of equity would be under the Universal Meal Plan as an example. State and federal sponsors would incur cost and reimbursement from school districts Under the No School Left Behind policy, a factor would be reduced or free costs to children in eligible low-income families. As an example, the No Meal Plan Left Behind food distributors and Target would get target assistance to food services programs that are facing challenges to funding their lunch programs. And with the Farm to Table, student families and schools can subsidize or apply for fixed rates to target assistance to food services that are facing challenges.
Policy Goals, Equity Part 2. Equity is based on the successful delivery of the services and benefits meant to be provided by the policies. The policies will be measured on their ability to properly feed all children coming from homes of food / financial insecurity, provide all school children with quality, desirable, and nutritious meals to support their academic development, as well as taking schools and food deserts into account during resource management. Explain how you are valuing scoring equity for your alternatives in the policy decision matrix. We want all children, regardless whether they live in Monterey or in the east side of Salinas, we want them all to be able to receive the same meals in school, the same quality, the same nutritious meals. It allows all children to learn valuable life skills that will allow them to be food independent, which is provide food for themselves. Access to nutritious food will not be dependent on the privatized food sector. Food deserts are found in marginalized communities. In discussing food deserts, we value equity in raising awareness for the lack of access to nutritious food and shining a light on the inequities and injustices people are faced with. Impact of distribution or transport delays is nearly eliminated.
In an effort to gauge the efficiency of these policies, we will be measuring their success and efficiency by the quality of food. The aim of the policy alternatives is to ensure that all school children are being provided the resources they need to grow and be successful academically as well as socially. Food is an integral component of student success, and public policy should strengthen nutritional values as well as providing quality meals regardless of region or student body demographics.
Policy goals, sustainability with farm to table. So incorporating more suitable produce food into school nutrition and serving 7 billion meals annually to all U.S. school districts can positively impact the health of students, our environment, and financial benefits. So if students in the classroom are learning about food, ecosystems, and waste, agriculture and food access issues, along with traditional nutrition and health education, can really improve efficiency and better planning for their meals. And also, students will waste less food. This will also help address the equity issue across the U.S., ensuring that all students have access to the farm-to-table school nutrition program provided by the school districts.
I'm Lauren, and I'll be talking about our group's recommendation for the issue of school nutrition. We recommend the radical policy alternative, which is the integration of farm-to-table practices, which would be to overhaul the current food systems that are currently implemented in California schools. The goal of this policy would be to change how students and communities view food and nutrition while building skills in self-sufficiency, as well as learning healthy eating habits. This radical policy change would teach students how to process food from farm to table. This would include teaching gardening skills in terms of planting and tending to a garden, and learning how to process fruits and vegetables. With this policy, students would also go on field trips to local fresh produce markets. Also, through this process, students would be taught how to recycle, reduce, and reuse. With this policy change, there would be more time allotted in current school curriculums, which would focus on teaching students of Monterey County to understand nutrition and what is needed to create a healthy lifestyle. Students would be taught basic cooking skills through cooking classes, with having cooking classes added to school curriculum. This would ingrain culinary schools in our youth that would help encourage healthy eating habits as well as reduce dependency on processed foods. Student would also be taught how to read nutrition labels. With this policy change, California state leaders would be expected to revise the current food pyramid and make sure it is up to date with current scientific findings regarding dietary needs. With this radical policy change, school educators, and administrators would be expected to create an environment that promotes ideals behind this policy change. Schools would provide healthy foods and avoid serving overly processed foods full of sugars and high saturated fat. School faculty would also interact with students during this learning process, as well as be advocates for funding and grants to make this policy change possible. This idea is already coming to life in the surrounding town of Watsonville at Starlight Elementary School, according to KSBW TV Action News 8. Starlight Elementary is the first school in California to receive a state-of-the-art kitchen and garden that aligns with our goals for this policy change in Monterey. With this program, students are taught to grow, prepare, and cook their own food. According to Starlight's principal, Jackie Medina, said the program will also allow children to put to practice what they learn in math textbooks by using fractions and recipes. With Monterey County being a highly agricultural area, the opportunity for a farm-to-table policy change is great, especially since Monterey County is the childhood poverty capital. This would be a great way to combat children from being hungry as well as learning how to create a healthy lifestyle. With this radical policy change, we can improve students' nutrition and connect with the community and resources available. Thank you for watching our presentation on school nutrition. If you have any questions, please let us know.